Do you know this device? What could be the contraindication of use of this device during neonatal resuscitation protocol? It's congenital diaphragmatic hernia. Surfactant first appear in fetal lung by 20 weeks of gestation. However, surfactant first appear in fetal lung alveoli by 33 to 35 weeks of gestation. Then, at what age surfactant do appear in amniotic fluid? Waste classification is used for acute hepatic encephalopathy. Do you know Sarnet and Sarnet classification, gross classification, as well as silence classification is used in which condition? To know the answer to those questions, please watch the video till the end. Welcome back to my channel. In INI-CET Rapid Revision Week 2, we are going to discuss many important high-yield pediatric MCQs in this video. Do not skip anything, watch till the end. Let's get started. I am Dr. Triya pediatrician and consultant neonatologist. I'll be your guide for pediatric subject. If you are new to my channel, please do subscribe and give like to this video because lot is going to happen for pediatrics on this channel. A 2.5 kilogram neonate is born to primigravida mother by LSCS. Baby cried soon after the birth. However, the mother is HbSAg positive. What will be the further plan of management for this baby according to the protocol? The options are hepatitis B vaccine immediately, hepatitis B vaccine as well as hepatitis B immunoglobulin both as soon as possible, C. hepatitis B vaccine later and hepatitis B immunoglobulin as soon as possible, hepatitis B immunoglobulin only. So what could be the answer to this question? In this scenario where the baby is born to the HbSAg positive mother, we have to give protection against the hepatitis B by both the way. Passive antibodies, that is hepatitis B immunoglobulin as soon as possible, preferably less than 72 hours of the delivery, as well as hepatitis B vaccine also to be given to provide active immunity for this child in a later future. Correct answer option B, hepatitis B vaccine as well as hepatitis B immunoglobulin as soon as possible. Now the next question is, what is this device? Where do you see it and what is the indication? So this device is called self-inflating bag. It is used in neonatal resuscitation protocol, and the indication for using this device is whenever there is apnea, gasping respiration as well as heart rate of newborn less than 100. This device is having many parts. Many a times it is used in a OSCE sport also. Here what you see is a face mask. This is expiratory valve. This is pop-up valve, and there is one more attachment over here for PIP valve. This is bag itself. This is air inlet one-way valve. This is air inlet pressure release valve. This is called reservoir. Sometimes it is like this also, and sometimes it is in the form of corrugated tube also, and the other attachment over here is oxygen inlet. So what could be the contraindication of using following device during neonatal resuscitation protocol? We have already discussed this question, and the correct answer to this question is congenital diaphragmatic hernia. Because whenever there is a congenital diaphragmatic hernia, what is happen? This is the diaphragm, and here there are intestine and abdominal content. If there is a hernia here, if we use this device during the neonatal resuscitation protocol, the air is going to go inside. The more air will enter the inside of intestine and the stomach. This will cause excess of pressure in the lung, further compromising the respiration of the child. So the single most important contraindication of using this device is congenital diaphragmatic hernia. Surfactant first appear in the fetal lung by which week of the gestation? This is also we have discussed. This is just a number. We need to remember this number. The correct answer to this question is 20 weeks. There are few facts about the surfactant. It's a phospholipid protein. Its major constituent is lecithin, phosphatidylglycerol, apoprotein and cholesterol, and these are the things which has to be remembered because many a times it is asked. The first appearance of the surfactant in the fetal lung is by the 20 weeks of the gestation. Surfactant first appear in amniotic fluid by 28 weeks of gestation, but lung alveoli will have a surfactant by 33 to 35 weeks of the gestation. That's why the babies who are born less than 32 weeks of the gestation are more prone to have a respiratory distress syndrome. Surfactant formed by type 2 pneumatocyte, it is stored in a lamellar body, and the stimulus for the surfactant production is pulmonary fibroblast secreting FPF. Now FPF stands for fibroblast producing factor. During the approach to a newborn with suspected congenital heart disease, a pulse oximeter should be attached to. It means in a neonatal period, if we have any newborn who presents with the features of the cardiac failure cyanosis, then to measure the oxygen saturation of that baby, which limb has to be used? Your options are right hand, right foot, left hand, or it is left foot. So correct answer to this question is right hand. Why? Why do we need to use a right hand? Here is the explanation to this answer. If you see the 4-chamber view of the heart, this is right atrium, this is right ventricle, this is left atrium and left ventricle. Left atrium receive the blood which is oxygenated from the lung by pulmonary veins. This will go to left ventricle, and this left ventricle have a origin of aorta. But in aorta, before there is a connection of the PDA, here there is a PDA. Before the even connection of the PDA, there is the origin of the brachiocephalic artery and right subclavian artery, which give blood supply to our right hand. So this is called preductal saturation. If the preductal saturation is on the lower side, then it is almost sure that child is suffering from the congenital heart disease. So the best answer to this question is right hand. A 5-month-old boy presented with the following facial features. Which cardiac anomaly is common in this child? Now look at the facial features of this child. The facial features are suggestive of micrognathia as well as retrognathia, as well as if you see there will be a cleft in a soft palate, and there is a falling of the tongue backward because of a small jaw. So this all features fit into the Pierre-Robin sequence, and in a Pierre-Robin sequence, the most common cardiac condition seen is a ventricular septal defect. What is the expected weight of the child aging 2 years? We need to know the formula. The best answer to this question, that at 2 years of the life, we apply the formula of 2x plus 8. Here x is in a year, so 2 into 2 plus 8. So it will be 4 into 8. So quite straightforward answer is option B, 12 kg. So what are the formula? If it is less than 1 year, we need to do x plus 9 by 2, x is in month. Between 1 to 6 years, it is 2x plus 8, and if the child is more than 7 years of the life, it is 3x. I have made a very beautiful video on anthropometry. If you have not gone through it, please go through it. The link is in the description box, as well as there is I button. Following equipment is used for, look carefully, this instrument or equipment is used in an anthropometric assessment, where this instrument is called Infantometer. This is used for the child who are less than 2 years of the age, where we cannot take the height as the child cannot stand properly, where we are going to take a length of the child. There we are going to use this instrument, and the correct answer is measuring length. Following equipment is used for measuring height, weight, skin fall thickness or crown rump height. This instrument is called stadiometer, and it is used for the measurement of the height for the child who can stand properly after the 2 years of the age. So following equipment is used for, what is this? This is nothing but this is Harpenden Caliper. This is used for measuring skin fold thickness. So correct answer to this question is skin fold thickness. Now waist classification is used in, Sarnet and Sarnet classification is used in, silence classification is used in, and gross classification is used in. Waist classification is used in acute hepatic encephalopathy. Here in stage 2 we will have a flapping tremors, this is asterixis. In 1 and 4 it will be absent. Silence classification is used for the osteogenesis imperfecta. Gross classification is used for tracheoesophageal fistula, and the Sarnet and Sarnet classification is used for the hypoxic ischemic encephalopathy in a neonate. So that's all about today's topic. I hope you all understood and learned well. We are going to have every weekly INI-CET revision set strategies for pediatric MCQs. So please let me know your suggestion and what else you would like to learn from me. Till that time, take care of yourself, study hard as well as study smart. Bye.